Hi, this is Sydney and this is my abdomen and pelvic exam assessment, and we are checking the room for no notes. There's Erica. And we just did a whole walk around and now I'm dizzy. So first I would check the chart of the patient, see what they were admitted for, and what problems they were having, see if they had any abdomen problems before or that was their admitting diagnosis, if they had any pelvic or genitalia problems when they first came in, if that was their admitting diagnosis. I would come in, make sure the chart was the patient, wash my hands, provide for privacy, and then I would introduce myself to the patient. Hi, my name's Sydney. I'm going to be your nurse today. Can you tell me your name and your birth date?
Erica Smith, 12/12/76.
And is Erica okay to be called by?
Yeah.
Alright, do you know where you're at?
McLaren.
And do you know why you're here?
For an exam.
And do you know what year it is?
2017.
Okay, so the patient is alert and oriented ×3, so we can continue on with the exam and get rational and clear answers. So first I'm just going to start with some subjective questions for you. Have you had any surgeries or traumas that have occurred in your abdomen or pelvic region?
No.
Do you have any massive scars, major lesions that you've noticed? Do you have any stretch marks?
No.
Do you have any pain in your stomach? Do you have pain when you use the bathroom, either bowel movements or urinary problems?
No.
When was your first menstrual period?
13.
13, and have they been pretty regular, or are they irregular but predictable, or?
Every month about the same time.
Okay, and are they heavy, light? Do you get bad cramps with them?
No cramping, usually just the first day's kind of heavy and a couple light days then.
Do you take any medications?
No.
With your periods, have you noticed the older you got, the lighter they've got, or no? Okay. Do you have any children?
No.
No. Are you sexually active?
No.
And have you ever used contraceptives?
No.
And currently not using any contraceptives?
No.
Okay. Do you have any history, family history of abdominal cancers, any rectal cancers, for males, any prostate cancers?
No.
Cervical cancers?
No.
Any family history of any problems in the abdomen or pelvic region?
No.
Have you ever had any problems in the abdomen and pelvic region in your history?
No.
Any hemorrhoids?
No.
Any anal fissures?
No.
Any polycystic ovarian syndrome?
No.
No? Okay, and so I'm going to actually just look at her first, and I'm not going to touch the abdomen region. I'm just going to lift her shirt up because we want to make sure that the bowel sounds are going to be still intact for me. So first we're going to inspect, and then we're going to auscultate, just so we can make sure that we're not disrupting those bowel sounds before the fact of us auscultating them. So as I'm looking at her skin, the stomach, abdomen region is symmetric. It is flat and not distended. Her skin is normal to her ethnicity. Her skin is dry and warm. There is no moisture. The umbilicus is midline, and I don't see any scars or lesions or bulges or masses as I'm just observing the top part of the abdomen. So next I'm going to auscultate to hear for the bowel sounds. In this, I'm going to listen to 3 different spots in each quadrant. So first we're going to begin in the left lower quadrant, and I'm actually going to make my way clockwise, ending in the right lower quadrant. And just let me know if you feel any pain anytime that we're doing this, and we can assess where that pain's at, and we can stop the auscultation. So I'm going to use the diaphragm to be able to listen. So bowel sounds are present in all 4 quadrants, and what we're pretty much looking for is almost like a quiet, low gurgling sound as we're moving through, and we would note after waiting a minute of auscultating, if we were unable to hear a bowel sound in that quadrant, we would chart that and further investigate why that was happening, or if laxatives were needed, or if there was dehydration causing the bowels not to be functioning. So also, while we're auscultating, we're going to auscultate the arteries of the abdomen region. We're going to use our bell, a little side for this one. And we're going to start at the aortic artery, which is midline. And then we're going to move our way down to the right and left renal artery. We're going to move down a little bit and also do the iliac, right and left, and then move down and do the femoral, right and left. And when doing the iliac artery, an easy landmark on the body to use is the belly button. If the belly button is midline. And for the femoral, we would just normally take the pants down a little bit and just do it right at the it's right after the common iliac artery. We would move down right under that, right below, right above the pelvic region. Okay, after auscultating arteries, there were no bruits present. They were all bounding at a +2. So now, as we're observing the stomach, are you in any pain after that?
No.
No pain. Okay, so next we're going to palpate, and we're going to palpate 3 spots again in the quadrants, each quadrant. And palpating, we're feeling for tympanic sound. And we're gonna feel dullness when we're able to percussing. When I percuss over the liver and the spleen, and those are the only spots that we're gonna find the dull percussing. So I'm gonna just percuss in 3 areas in each quadrant. So after percussing, over top of the liver was dull. As soon as we hit over top of the liver was dull, and over top of the spleen was dull. And as we percussed above the liver, it was a resonant sound, and below the liver it was a tympanic sound, as well as the rest of the abdomen was a tympanic sound. So now we're just going to lightly palpate, and this is where we're actually going to further look for those bulges or masses that could be underneath that we were unable to see with our eyes. So we're going to start by first lightly going about 1 inch in, and going to lightly palpate just around in 3 spots in each quadrant again, just to see if we can feel anything. And if you become tender or pain at any time during this, just let me know, okay? As I'm tickling her. And did that hurt at all?
No.
Okay, so now I'm going to do a deep palpation just to feel further into the abdomen region, just in case that light palpation may have missed some masses or bulges that were deeper into the abdomen cavity. So after I was done palpating, there were no masses, there were no bulges found. If those were found, we would chart those and further explore into that No tenderness or pain was reported when I was palpating the abdomen region. Now we would move on to the pelvic exam of this part of the assessment. However, we would look for hair distribution in the pelvic region. For a woman, we would ask if there has been any discharge. Have you been having any unusual discharge?
No.
Any itching?
No.
Have you noticed any rashes or any thing that's been going on?
No.
We would then look for possible discharge that was present. We then would ask about the self-care in the woman. Do you take showers regularly? Daily. Are you able to clean in your genitalia area thoroughly? Along with that, do you ever just check down there to see if there's any lesions, any bumps?
Yeah.
Just sometimes, we then would look for edema, swelling, any lesions, bruising, rash, which if any of those were found, we would also chart that. In a male patient, we would also check for hair distribution. We would ask their testicular hygiene, if they're able to clean daily, if they are able to clean their genitalia accurately and be able to make sure that it is a clean environment. If there's any rashes, lesions, edema, if there's any itching, any burning during urination, we also would look for drainage as well and discharge from the male genitalia. And then we would also look at the testicular area as well to see if there's any nodules, any masses or bulges, to make sure that the testicular area, they were both equal in size and one wasn't bigger than the other. We also would ask about their testicular self-exams, if they were able to complete those on their own, if they frequently check. Kind of the same as women do the self-breast exams. It's very important for males to also do this, so they can be self-aware of their testicular area and see if there's any bulges, any nodules that are uncommon for them, anything out of the ordinary that they're able to have a monthly check on their own to be able to notice a difference and be able to come into a healthcare facility to get that checked out and be able to further investigate it. After that, we would then perform the anal and rectal exam. This would just be more along the lines of, do you have normal bowel movements? Have you ever had a hemorrhoid?
No.
Are you constipated?
No.
Do you eat? How often do you eat a day?
3 times.
3 times a day. And how much water do you intake?
I get my daily recommended.
Daily recommended?
Yeah.
Do you take any medicines that would make you constipated or irritate the GI tract, which was then back up into the rectal cavity?
No.
No. We would check the rectum and anal cavity for any fissures. We would check it for hemorrhoids, any lesions. And then if there was any fecal matter there for us to examine, we would check for occult blood that was evident in that, and then we would further investigate on that. So I'm actually going to move you up. How are you feeling after that?
Fine.
Fine? Mm-hmm. Do you need anything for pain?
No, thank you.
Nothing? All right. I am going to leave you with your call light, and if you need anything, you can just press the little red nurse on there for me.
Okay, thank you.
So then I would wash my hands, and I would make sure the patient was comfortable, and then I would leave the room. Thank you.